So, good afternoon once again, and as we are continuing with the development of cardiovascular system, and if you remember the very first lecture, we have discussed about the process of formation of blood vessels and the heart tube. Yeah. So, can you just try to summarize it? Try to recall and tell it. Yes, beta. So the mesenchyme, the mesodermal embryological connective tissue, yes. Yeah. So from that the cells are derived, which we call angioblast. Yeah. Yes. Yeah, right. So we began with this. Good. Sit down. Yeah. So and then, like as far as today's lecture is concerned, we will further elaborate how these arteries, the named big arteries and other small arteries, how they develop. So if you can recall, and as she has just told very correctly, so this development of these blood vessels begin in the third week. Okay. And we know the process called as vasculogenesis and the angiogenesis. So I will come to these two terms again. We have already discussed it. We will discuss it further today again. So now vasculogenesis is formation of the new blood vessels, and angiogenesis is, you can see this like there is a budding, endothelial budding from the vessels which are already formed. So this is kind of a sprouting of the vessels into the adjacent areas. So this is the difference between angiogenesis and the vasculogenesis. Okay, and this process starts in the yolk sac. So approximately up to first 2 months, up to 60 days, this yolk sac acts as a hematopoietic organ. You understand the term hematopoietic? The one which produces the blood cells, yes. And after that, liver, spleen, thymus, bone marrow, they take over this function of this formation of the blood cells. Is it clear so far? Right. So basic two terms, vasculogenesis and angiogenesis. And as we can see in this diagram, so this vasculogenesis, as we have discussed, begins in the yolk sac, basically, and it starts from the mesodermal cells, as we already discussed, and as we have drawn the diagrams in the previous lectures about this process. So these mesodermal cells or the mesenchymal cells, they form the blood islands, and that consists of this hemangioblasts. Okay, and these hemangioblasts further differentiate into two type of cells. So those are hematopoietic stem cells and endothelial precursor cells. These two cells. Last two benches, second last bench, both of you stand up and come forward, please. First, yeah. So this, you also, yeah. So this primitive hematopoietic stem cells and endothelial precursor cells. So these hematopoietic stem cells, they differentiate to form blood cells, whereas this endothelial precursor cells form the vascular endothelium. Is it clear? This two, yeah. Now even you can recall those two diagrams, which are drawn earlier. So these angioblasts, or we can say this hematopoietic stem cells and this epithelial precursor cells, right? So these angioblasts, no, they gather together, they form clusters or the cords, right? And then after that they rearrange themselves in such a way that lumen appear in them. If you can open the diagrams of the first lecture, you can recall that. So they rearrange themselves in such a way that lumen appears, and this is how we get the structure with the lumen, the blood vessels, right? And later budding appears from them, and those budding gives branches. So further branches and further blood vessels we do get. So this is how this formation of blood vessels takes place. And then we have also gone, we have seen how by this process endothelial heart tubes are formed, right? And then we have discussed how these heart tubes fuse with each other, two tubes form one single tube, and how that tube is divided into four parts. What are those four parts? Truncus arteriosus, bulbus cordis, primitive ventricle, primitive atrium, right? And then we have further seen how what is derived from what, and then the chamber, the division of these chambers, the formation of the septa, all these things we have already discussed. Now let us discuss today how arteries develop. Okay, and maybe in the next lecture we will see how veins develop. So the primitive aorta, basically the so it arises from the arterial end of the heart tube. We have seen the so arterial end is the truncus arteriosus. So in this diagram, if you see, where we can see the embryo and we can see this all the coverings of it, and we can see this arteries as well as veins which are connected to the heart tube. So this portion here is the heart tube in the diagram, and you can see this portion which is continuous with it, the primitive aorta. Now this primitive aorta, what happens now, it curves, okay, and then it continues on the dorsal aspect of the developing fetus or developing embryo. So it can be divided into three parts. So the part which lies ventral to the foregut, so this here developing embryo, here is the foregut. The part which lies ventral to the foregut, that is the ventral aorta. So there are basically two ventral aorta and two dorsal aorta on either side. Okay, so there are two primitive aorta. This primitive aorta, as you can see in this diagram, can be divided into ventral aorta, which is ventral to the foregut. Then there is a dorsal aorta which is dorsal to the foregut, and there is this arch-like structure which connect the ventral aorta and dorsal aorta, and that is the arch artery. Okay, so in the beginning there is only one arch artery, that is the first arch artery, and then further arch arteries will be developing, that we will see again. Any query in this? Yeah, I will repeat it again. As you can see in this diagram, now what happens first, there is now like as I told you in the beginning also, see, development of this cardiovascular system starts around third week, and many changes takes place simultaneously. It is not like we have discussed development of heart tube first, that means first heart tube is formed and then the next and then the next and then the next. No. So most of the things are happening simultaneously. So when heart tube is forming, maybe after a little time after that, this primitive aorta also they are formed. So these changes are taking simultaneously. Now this primitive aorta is continuous with the truncus arteriosus. So there are two primitive aorta actually. Okay. Now these two primitive aorta, they curve to reach the caudal end of the fetus. After arising from the truncus arteriosus, they get curved like this, they get curved and reach the caudal end of the developing fetus. Now you can see here in this portion, this portion, see, this is the midgut, this portion we can call foregut, and this is hindgut. This development of GIT is not yet started, but you can assume that the part which is towards the anterior aspect, towards the ventral, towards the cranial end is the foregut. The middle part, the midgut. The part of the gut, developing gut, which is towards the caudal or towards the lower end, okay, that will be the hindgut, like that. So somewhere here is the foregut. So the part of the aorta which is ventral to the foregut is the ventral aorta, and the part which is on the dorsal aspect is the dorsal aorta, and the part connecting these two is the arch artery. So as this is a simplified schematic diagram. I hope you will understand with that. See, so what happens now is, this is the developing, two heart tubes are there, developing primitive heart tubes. to connect, continuous with them is the aorta. So there are two aorta, primitive aorta. So this end is the ventral aorta, here is the dorsal aorta, and the portion connecting this ventral and dorsal are the arch artery. Now why it is called arch artery? Because it is related with the pharyngeal arch. Okay. Now question will be, what is arch, pharyngeal arch? Because it is also not yet taught to you. To make it simplify, just you can see this diagram. So pharyngeal, what pharyngeal arches are? These are the segments of the tissue. They are paired and they are present on either side of the developing pharynx. So when the folding of the embryo was taught to you, this head bulge we have discussed, stomatodium has been told to you, pericardial bulge we already discussed, and whatever the changes we have seen, whatever the development we have seen so far of the cardiovascular system, this happens in this area, right? Pericardial bulge and area related to that. So now this is the like we can say a lateral view of this folded embryo, and this is the ventral view. So again this is a schematic diagram, and here we can see that this is the head bulge, and here we can see the stomatodium from the when we look it from the anterior aspect, and here is the pericardial bulge. And now this area is actually the area where pharynx is going to develop. And in this area, on either side of it, there develops some segments of the tissue. Can you appreciate this? So these are pharyngeal arches. So from these pharyngeal arches, you will see later where different structures of the head, neck, okay, are derived. So maybe once we finish the cardiovascular system, then we will start the development of pharyngeal arches. That time we will discuss more detail about this, but I hope you got the basic idea of pharyngeal arch. Related to pharynx, that's why pharyngeal, arch-like structure, paired, that's why arches. So pharyngeal arches. Okay. And so each pharyngeal arch has got its own artery, its own nerve, its own cartilage and muscles. All these details will be taught to you in the coming classes. Now come to this slide again. So we have seen that three parts of the primitive aorta, the ventral aorta, dorsal aorta and the aortic arch artery, right? So and this aortic arch artery connect the ventral aorta with dorsal aorta and passes through the first pharyngeal arch. Now this sentence is clear? Yeah? So as there is a first pharyngeal arch artery, so there will be first arch, second arch, third arch, fourth arch, fifth arch, sixth arch. Similarly, there will be first arch artery, second arch artery, third arch artery, fourth arch artery, fifth and sixth arch artery. Is it clear? Yes, this is yeah. So once this is clear, then only we can go to the next. So later, as I told you again in detail, there will this pharyngeal arches will be taught to you in the coming classes. Now let us come to our today's class again, the development of arteries. Now what happens? We have seen that initially there are two heart tubes, they fuse with each other to form a single heart tube. So when this fusion takes place, two heart tubes fuse with each other, the ventral aorta, which is continuous with the truncus arteriosus, they also fuse with each other. So now this, but that fusion is not complete. Okay, the part which is near to the or continuous with the truncus arteriosus, that fuse, and that part after fusion forms a structure called as aortic sac. What does it form? Say it loudly. Aortic sac. And the unfused part, as you can see in this diagram, they form right and left horns of this aortic sac. Horns or the branches, right? Getting it? Yeah. And now you can appreciate from this diagram now that this is the first arch artery and okay, and then this is the dorsal aorta, and here this portion is the ventral aorta. So ventral aorta is continuous with the trunk. Yeah. So this now ventral aorta is divided here into aortic sac and the the left and right horn. So after fusion, is this clear? So I'll repeat again. See, we have seen the formation in the earlier lecture, formation of the heart tubes. Heart tube fuse with each other, and we have seen today that the primitive aorta is continuous with the truncus arteriosus. So the heart tube, when it fuses with each other and form a single heart tube, this two ventral aorta, they also fuse with each other, and what they form? Aortic sac, right? So after fusion, and the remaining, the part which is unfused, what did form? Left and right horns of aortic sac, right? So continuous with these horns, you can see from this diagram, is the first arch artery, and that is connecting the horns of the aortic sac to the dorsal aorta. Is it clear? Yeah. Now what happens now later? So as I told you, so successively there is formation of second pharyngeal arch, third, so there will be arch artery of it. So there will be formation of the arches, and in that there will be formation of the arch arteries. So successively there will be formation of second arch artery, third arch artery, fourth arch artery, fifth arch artery, and sixth arch artery. So they will be connecting the left and right horns of the aortic sac to the dorsal aorta. You are getting me? Yes or no? So first arch artery, as we have seen in this previous diagram, initially there is only first arch artery connecting the horn of the aortic sac, right and left, as to the dorsal aorta. Later there is development of second arch, third arch, fourth arch, fifth arch, sixth pharyngeal arches, and similarly there will be development of arteries into that. So this second arch artery, third arch artery, fourth arch artery, fifth arch artery, sixth arch artery, they will be connecting the horns of the aortic sac, corresponding horns, to the dorsal aorta. Dorsal aorta are not fused. What happens later? So when they are connected, no, so only distal part of it, the caudal part of it, get fused and form the single aorta. Yeah. So far what we have seen is, we have seen formation of two, primitive aorta, division, then it's how we have seen that which part is called ventral aorta, which part is called dorsal aorta, and then we have seen arch artery connecting this ventral and dorsal aorta. Okay. Yeah. Now come to the further development. So for that, I have told you the concept of the pharyngeal arch artery, right? So the artery which is present in the arch, developing pharyngeal arch, is the pharyngeal arch artery, and it connect ventral aorta and dorsal aorta. Is it clear? Right? So now each arch has its own artery. We have seen this. So initially there are 6 arches, so there are 6 arch artery. Later what happens now? Arches disappear, so pharyngeal arch disappears, so this arch artery also disappear. So what happens now? First, fifth arch artery disappears. So what remains? The remaining are the first, second, third, fourth, and sixth arch artery. And later what happens? First and second arch artery also disappear. Only small part of them remains behind. Is it clear? So if we say, so from these two diagram, it will become clear that you can see here that there is a first, second, third, fourth, fifth, and sixth arch arteries, right? And they are connecting the ventral and dorsal aorta. So basically this is a schematic diagram to make you understand. And then what happens? There is this first disappears, only small part remains. Second also disappears. Third arch artery, fourth arch artery, sixth arch artery, they remains. And fifth also, third, fourth remains, third, fourth, and sixth remains, fifth also disappear. So this is what happens. So what we get is here, third, fourth and sixth. So I will repeat again. So initially there are how many arch arteries? 6 arch arteries. Now first and second disappear, only small portion of these two remains. Third remains there in total, fourth remains in total, fifth disappears completely, and sixth arch artery remains in total. So what we get is basically very small part of first and second, and mainly third arch artery, fourth arch artery, and sixth arch artery. Is it clear? Now what happens, this third and fourth arch artery open in the corresponding horns of the aortic sac. You can see from this diagram. Is it, can you appreciate from this diagram? So this third arch artery and fourth arch artery, they are opening into the horns of the aortic sac. Here is the aortic sac and these are the two horns of the aortic sac. And sixth arch artery open on the dorsal aspect of the aortic sac. So this is the sixth arch artery opening into the dorsal horn of the aortic sac. This concept is clear? So again I repeat, remaining arch arteries are third, fourth and sixth, okay, in total, and very small portion of the first and second. As you can appreciate from this diagram, third arch artery and fourth arch artery, they are opening into the horn of the aortic sac, while sixth arch artery is opening on the dorsal aspect of the aortic sac itself. Is it clear? Any doubt in this? Yes, anyone? Yeah. Now we have already seen in the previous lecture that the spiral septum develops, okay, and the spiral septum divides the truncus arteriosus into ascending aorta and pulmonary trunk. By mistake it is written the aortic sac. Basically truncus arteriosus get divided into pulmonary trunk and the ascending aorta, and this ascending aorta becomes continuous with the ventral part of the aortic sac, while pulmonary trunk become continuous with the dorsal part of the aortic sac. Okay, and yeah, so basically what happens when truncus arteriosus is divided by the spiral septum, this spiral septum divide aortic sac as well into dorsal and ventral part. You are getting? So that the ventral part of the aortic sac is continuous with the ascending aorta, and dorsal part continuous with the pulmonary trunk. Is it clear? Yeah. Now these things are very important. What changes are happening are very important to understand how arteries will be derived. Okay, so whatever these 5-6 points are there, these are very important. I will explain, and if you don't understand, ask me, I will explain again. Okay, so now what happens now? Dorsal aorta, which is here, this is dorsal aorta, right? So this dorsal aorta grows cranially beyond this third arch artery. If from this diagram, now here, see, this is the dorsal aorta, here is the third arch artery. Now it will extend beyond. Can you appreciate now in this diagram? Okay, so on either side, this dorsal aorta will extend beyond the third arch artery. So this has happened here. So dorsal aorta extension. Then dorsal aorta between third and fourth. This is the third arch artery. This is the fourth arch artery. So dorsal aorta between this third and fourth arch artery disappears. You are getting me? So which was present earlier, this portion, now it disappears. Next change what happens is, the third arch artery which is here, this third arch artery will give one bud. Can you appreciate? This, it gives one bud. Okay. Then changes takes place in the sixth arch artery. So this sixth arch artery which is here, this sixth arch artery, now in this area somewhere, just to make schematic representation, so assume this is the developing lung bud. So this sixth arch artery, what does it do is it gives a branch to the developing lung bud, because most of the systems are developing simultaneously. So developing lung bud gets branch from this sixth arch artery. Now another one more change very important to notice is part on the right side, part of the sixth arch artery beyond this lung bud disappears. Can you appreciate that? Excuse me please, both of you. I have marked you present. You please leave. You are disturbing me. Please leave. Please. My lecture is getting recorded. Don't make me shout. Please leave. Yeah. So this sixth arch artery beyond the lung branch to the lung bud disappears. Okay. This is you got it?
Yes, sir.
Yeah. Now part of the dorsal aorta. Now one more very important change. So dorsal aorta distal to the seventh intersegmental artery disappears. Now question is, what are the intersegmental arteries? Okay, so I will explain that. So if you see this diagram now, this when dorsal aorta is going on the dorsal aspect of the developing embryo, then what happens? Distal part of it or the caudal part that fuse with each other, as you can see in this diagram. And what happens? All this dorsal right and left dorsal aorta as well as the fused part, okay, of the dorsal aorta, it gives branches, the budding branches, which supply to the area of the embryo, developing embryo there. So these branches, basically these are called as segmental branches. Okay, branches coming out from the dorsal aorta and supplying that particular area, nearby area of the embryo. These are the segmental branches. This is clear? So first segmental branch, second, third, fourth, fifth, sixth, seventh, like that. So there are segmental branches of this dorsal aorta. Now what happens now? So just assume that these are the seventh intersegmental branch. Now part of the dorsal aorta on the right side distal to this intersegmental branch that disappears. Is it clear? You are getting me? Vedant? You are looking confused? You are getting me? I will repeat again. I will repeat all these changes because these changes are very important. Then only we will understand how and why and from what source the major arteries are developed. So I will tell you again. So dorsal aorta, what happens first is the dorsal aorta grows cranially beyond the third arch artery. As you can see previously these arch arteries are like this. Now here is the third arch artery. Beyond this it will grows. So the dorsal aorta grows cranially beyond the third arch artery. This is that portion, the extended portion. Is it clear with everyone?
Yes,
second change is the dorsal aorta between third and fourth arch artery disappears. Is it clear?
Yes,
next change is sixth arch artery here. The sixth arch artery gives a branch to the developing lung bud. So the developing lung, it gets branch. Okay. Now next change is part of this sixth arch artery distal to the lung bud disappears. And the next change is part of the right dorsal aorta, the dorsal aorta on the right side, distal to the seventh intersegmental branch, that disappears. Is it clear? So these are the changes happens. Yeah, and one thing remains. Yeah, so third arch artery gives a bud. Is it clear? Once you understand this, then we can understand very easily how the major arteries develop. Now what are the major arteries you have seen in the dissection of the thorax? Even before that? Even before that? The branch arising ascending aorta, the major artery, right? Ascending aorta and pulmonary trunk, right? And then the branches of the arch of aorta, right? So, and then and descending thoracic aorta and these major arteries. Okay. So arch of aorta giving rise to brachiocephalic trunk, and left common carotid left subclavian, and then brachiocephalic dividing into or giving two branches, right common carotid and right subclavian, right. So these are the major arteries and the pulmonary trunk. We will see how they are derived. Okay. So is it clear so far? Yeah. Now let us see how development of major arteries takes place. So if you have seen so far, we have seen that this is the aortic sac, this is the left and right horn of the aortic sac. We have seen that third and fourth arch artery are continuous with the horn of the aortic sac, while sixth arch artery is continuous with the dorsal aspect of the aortic sac itself. And okay, now from this we can see that first major artery, the arch of aorta. So arch of aorta, it will develop. So ascending aorta, we have seen ascending aorta develops from what? Truncus arteriosus, right? So ascending aorta develops from the truncus arteriosus, and ascending aorta continues as arch of aorta, right? Right? And we have seen that ascending aorta is continuous with what? Ventral part of the aortic sac, right? So this ventral part of the aortic sac, then the left horn of the aortic sac, this you can see is the fourth arch artery, okay, up to the seventh intersegmental artery. The part of the dorsal aorta up to the seventh intersegmental artery, that will give rise to the arch of aorta, as you can see from this diagram. See from here to here is the arch of aorta. Now how it is derived, see carefully in these two diagrams. See this, the first portion of it is derived from the left horn of the aortic sac. Next portion is from the fourth arch artery, and the next portion is from the dorsal aorta up to seventh intersegmental artery. So this is how arch of aorta is derived. Is it clear? Now from this you can appreciate that this portion is a branch of this arch of aorta. So what is this? This is giving rise to the common carotid artery on the left side. So common carotid artery on the left side is derived from the third arch artery. Is it clear? Yeah. So common carotid artery on the left side from the third arch artery, and then you can see this bud which arises earlier, we have discussed about it, that will give rise to external carotid artery on the left side. And this portion, the part of the this part of the third arch artery distal to the bud is the internal carotid artery, and also the part of the dorsal aorta which extended beyond the third arch artery. So that gives rise to the internal carotid artery. So internal carotid artery is derived from two sources. The proximal part is derived from third arch artery, okay, after this bud up to this extension of the dorsal aorta, okay, and distal part of this internal carotid artery is derived from the dorsal aorta which has extended cranially. Is it clear? Anybody has any doubt? See, this is very, I mean, until and unless you understand the previous slides, you will not understand this. So this is clear. We have seen so far the arch of aorta and the first branch of it. What is the first branch? Left common carotid artery. Which is the second branch of arch of aorta? Subclavian, left subclavian. So left subclavian artery, can you appreciate this? What is this? Seventh intersegmental artery. So seventh intersegmental artery gives rise to left subclavian artery. Clear? What is the third branch of arch of aorta? Brachiocephalic trunk. Anybody can tell me from these two diagrams from what the brachiocephalic trunk is derived? Yes, you can try. I will help. Right horn of the Aortic sac, yes. So right horn of the aortic sac is giving rise to brachiocephalic trunk, and then this right, and you can see that now this right horn, what are the two branches of the right horn? Here these two, third and fourth, are opening into the right horn, right? We have seen that earlier. So that's why the right common carotid artery and the right subclavian artery are the branches of the brachiocephalic trunk. Now we will see how they are derived. Okay. Now it is easy from this. You can see that the right common carotid artery is derived from the third arch artery, isn't it? Up to the bud, right? Up to the bud for the external carotid artery. External carotid artery is derived from this bud, and internal carotid artery again the part of the third arch artery as well as part of the arch of the aorta extending cranial to the third arch artery. Clear? And then from this we can appreciate very clearly that the right subclavian artery, it is derived from part of the fourth arch artery as well as from the dorsal aorta as well as from the seventh intersegmental artery. Yes, beta.
Earlier the carotid artery and the subclavian artery were continuous because the dorsal aorta between third and fourth did not disappear. But after it disappears, they became separate.
We cannot say earlier. We are talking of they were that time they were called arch arteries. They were arch arteries, isn't it? And they were, we cannot say continue. They were coming and opening, or they were continuous with the right horn actually. Your doubt is clear? Yes. So we have seen so far development of arch of aorta, development of left common carotid, development of left subclavian and brachiocephalic. These are the three branches of. Why you are like this, Vedant? You are not getting. I was afraid you are going to pluck out your hair. So what? Okay. Yeah. Yes. Maybe I'll take a small break so that you will get refreshed. Yeah. So what I want to tell you a very small incident. Yeah. Yeah. So what happens? This is a nowadays tendencies of people in this era. I just want to tell you a small incident. So what happens? There was a man maybe around 35, 36 years old, having a boy of maybe 4 or 5 years old, and boy was like just started understanding, getting mingled with the world. So one day what happened? Father brought the apples, 2 apples only, and just after washing it, he was just kept it on the table. So boy came running and grabbed both the apples. Okay. And he asked, Papa, can I eat? He said, so Papa said, yes, it's for eating only, we can eat. But he said, there are 2 apples, give one to me. Okay. Now what boy did is, smart kids nowadays, what boy did is, he took a bite of one apple. So Papa said, give me that one. He took bite of the other apple as well. Okay. Naughty boy. So now actually father was little disappointed. He thought, what a generation nowadays. They don't want to share and all. And he was little disappointed and all. And his thought process was going on that direction. But after a moment, these thoughts were in his heart. And what the boy said, Papa, take this apple, this is more sweet. You got? So many times, it depends on, इसको हिंदी में नजरिया बोलते हैं ना, नजरिया. हमारा नजरिया बहुत बार अलग अलग हो सकता है, isn't it? So सही नजरिया रखो, maybe हमारे फ्रेंड्स के लिए नजरिया, हमारे टीचर्स के लिए नजरिया, हमारे पेरेंट्स के लिए नजरिया अलग अलग हो सकता है. Try to have a correct perspective. Yeah. So shall we come to this again?
Yes, sir.
Yeah, maybe now we will not pluck the hairs. Yeah. So I'll tell you again. First, the development of the arch of aorta. So arch of aorta, how does it develop? It develops from the, yes, you can say with me, left horn of aortic sac, then fourth arch artery, and then part of the dorsal aorta up to seventh intersegmental artery. The first, then the branches of the arch of aorta. The left side, left common carotid artery. Left common carotid artery is derived from third arch artery up to the bud for the external carotid. External carotid on the left side is from the bud which was from the third arch artery, and then internal carotid artery from two sources. The proximal part is from third arch artery and distal part from dorsal aorta, which got extended cranial to the third arch artery, right? Then the left subclavian artery derived from seventh intersegmental artery. Then the another branch of the arch of aorta is brachiocephalic trunk. It is derived from right horn of aortic sac, and from this we can appreciate these are the two branches of it, right? So right common carotid artery is derived from third arch artery up to the bud. Then this is the external carotid artery derived from the bud itself, and then the internal carotid artery, again proximal part from the third arch artery and distal part from the dorsal aorta ka extension. Is it clear? Then the right subclavian artery, it is derived from three sources. First is this fourth arch artery, then the part of dorsal aorta up to seventh intersegmental artery, and then seventh intersegmental artery itself. Got it?
Yes.
So these are the major arteries, how they develop. Now question may be asked in a different manner as well. It can be asked as a derivative of aortic arch arteries. So we have talked about aortic arches. We have talked about each arch has got its artery. So there is a first arch, got first arch artery, second arch got second arch artery, third, fourth and sixth and so on. So what we have seen that first and second arch arteries almost disappear. Very small part of it remains, right? So from that, from the first from the first arch artery, maxillary artery is derived. So you will get, when we start with a head neck face dissection, we will learn about maxillary artery, but you can appreciate the area, the maxillary region will be supplied by the maxillary artery. And then from the second arch artery, we get two arteries, one hyoid artery and the stapedial artery. These two arteries are derived from second arch arteries. Third arch artery we have seen, okay. So it forms what? Common carotid artery, proximal part of internal carotid artery, and it also gives a bud that forms the external carotid artery. Is it clear?
Yes.
Yeah. Now fourth arch artery is on either side, it is different, right? So on the left side it forms the arch of aorta, part of arch of aorta, but on the right side it forms, yeah, so proximal part of right subclavian artery it gives rise to. Is it clear? We have seen fifth arch artery disappears. As far as sixth is concerned, on the left side, this left pulmonary, it gives rise to left pulmonary artery, isn't it? And ductus arteriosus, what is that? I will tell you. And on the right side, it forms a right pulmonary artery. Now I will tell you what the ductus arteriosus is. So if you remember, I told you that this, we have seen this, right? Part of the sixth arch artery beyond the lung branch disappears, right? But on the left side it remains. So this portion is connecting what to what from this diagram? Can you appreciate? Dorsal, yeah, it is connecting dorsal aorta to the pulmonary artery. Now what happens here is, from this we have seen that develops the arch of aorta, right? So ultimately this structure, what it will connect? It will connect pulmonary artery to the, no, what derives from it? Arch of aorta. So you can see here in this diagram. So this structure, the part which doesn't disappear on the left side, that actually connecting this pulmonary artery to the arch of aorta, and this structure is called as ductus arteriosus. And this ductus arteriosus is having very important role in fetal circulation. So is it clear? Derivatives. Yeah. And then what happens, as we have discussed already, vasculogenesis and angiogenesis. So further there are other arteries which are developing by this process, vasculogenesis and angiogenesis. Is it clear? Yeah. Now let us come to the fetal circulation. As the name suggests, fetal circulation, the blood circulation happening in the taking place in the embryonic period or the fetal period. Now what happens, we have to understand very important fact that during fetal life, till the baby is born, the respiratory system is not functional. Okay, that's why process of oxygenation is not taking place in the fetus. So fetus is totally dependent on mother for the oxygenated blood, isn't it? Now oxygenated blood should reach the fetus by some source, and that source is umbilical vein. You know, any vessel carrying the blood towards the heart is vein. That's why the umbilical vein carries the oxygenated blood, but it is called as vein. That you have to remember, you have to understand it very clearly. Umbilical vein carries the oxygenated blood from mother. Now which part of the mother? From placenta. Maternal tissue is the placenta, from the placenta to the fetus, and it is covered in a structure called umbilical cord. You have heard about umbilical cord, right? So there is a maternal structure called placenta. We have seen development of placenta, right? So then we have seen development of umbilical cord as well. Umbilical cord has got two arteries and one vein. So these two arteries are actually carrying the deoxygenated blood from the fetus towards the placenta, and umbilical vein is carrying the oxygenated blood from the placenta to the fetus. So as you can see this from this diagram, see, this is the umbilical cord having this one umbilical vein and two umbilical arteries. Now this umbilical cord is up to the umbilicus of the fetus, right? So it enters here. So now here you assume this portion is the umbilicus, and from here it is entering inside. Now, now here what happens? No, this umbilical vein actually, once it enters in the fetus, it will go and reach in the liver. It reaches up to the liver, and there what happens? No, it is connected by a structure called ductus venosus to the inferior vena cava. So basically inferior vena cava is carrying the deoxygenated blood from the fetus, okay, systemic circulation to the heart. Now it is carrying the deoxygenated blood, but the oxygenated blood which is brought from the placenta by the umbilical vein, now it is getting mixed here. Okay, so this is the site where oxygenated deoxygenated blood is getting mixed. So umbilical vein, the blood which is inside that is emptied into what is this? Inferior vena cava with the help of the structure called ductus venosus. Now inferior vena cava opens where? Into the right atrium. Now what happens? We have seen the development of interatrial septum and foramen oval. Now when blood comes into the right atrium, most of the blood, there is a tubercle called intervenous tubercle of lower, that direct most of the blood which is coming into the right atrium towards the foramen oval, and through the foramen oval, where does it go? It goes to the left atrium. So now left atrium it comes, and then through the atrioventricular valve it comes to the left ventricle. From the left ventricle what starts? Which big artery? Ascending aorta. So it will enter into the ascending aorta. From the left ventricle it will enter into this oxygenated blood, and then what happens? It from ascending aorta, arch of aorta, and descending aorta, like this. Now what happens here is, whatever the small amount of the blood, most of the blood, we can say 80 to 90% of the blood from the right atrium goes to the left atrium. Some blood go to the right ventricle. From the right ventricle starts what? Pulmonary trunk. And now what happens now? So some blood goes to the right lung, some blood goes to the left lung. But most of the blood from this from the left pulmonary branch or left pulmonary artery carried to the arch of aorta by ductus arteriosus. Okay, so very less amount of blood goes to the actually lungs. So it is coming into the actually the aorta, and then descending aorta, further branches of it, and it is distributed to the developing fetus. And finally what happens now? We know that these branches, the internal iliac artery, from the internal iliac artery starts these umbilical arteries, and these umbilical arteries will take the deoxygenated blood to the placenta. Is it clear? This is the fetal circulation. So what happens first? Umbilical vein brings the blood, goes up to the liver. Okay, there what happens? There is a channel called ductus venosus that connect the umbilical vein to the inferior vena cava. So most of the oxygenated blood is now in the inferior vena cava. Inferior vena cava opens into the right atrium. Most of the blood, 80 to 90% blood goes to the left atrium through foramen oval, isn't it? And then now so and from there to the left ventricle, from the left ventricle to the aorta, from the aorta it is distributed to the rest of the part. And then from this portion, now what happen distally from the internal iliac artery start the umbilical arteries, and this is how it is brought back to the placenta. Now there, and we have seen that what happens, the ductus venosus is the channel which takes the blood from the umbilical vein to the inferior vena cava. So this is the first site where blood mixing takes place. Okay, oxygenated and deoxygenated. Second site where oxygenated deoxygenated blood get mixed is the right atrium, because what happens, the superior vena cava also bringing deoxygenated blood. So here also deoxygenated oxygenated blood is getting mixed. And third side is like in the aorta where ductus arteriosus also get the blood and open it into the aorta. So these, and now after birth what happens now? After birth, that is why it is very important to baby should cry. When baby cries after birth, because of the cry, the air goes inside, the lung expand and lungs start functioning. And when lungs start functioning, then what happens now? Then the systemic pressure on the left side become more, the foramen oval closes physiologically, and there is no, now as lungs start functioning, because what happens now after birth, umbilical cord is clamped and cut. So there is no oxygenated blood coming from the placenta and the mother. So now oxygenation of the blood, that process is taking place by the lungs itself. And so that what happens now, first change that takes place is now this ductus venosus, nothing is like in that, now blood doesn't flow through it, so it becomes ligamentum venosus or ligamentum venosum. Foramen oval closes, that is the second change, and ductus arteriosus get converted into ligamentum arteriosum. So these are the basically, and this umbilical vein, it becomes ligamentum teres hepatis. So these are the changes that takes place after birth, okay, in the fetal circulation. So this is what all about the development of arteries and the fetal circulation. Okay, so you read, yeah. Truncus arteriosus.
So the left pulmonary
Hmm?
left pulmonary artery should have the ductus arteriosus.
Sorry?
The ductus arteriosus
Huh?
should be on the left pulmonary artery.
Yeah, it is on the left. So here,
Pulmonary trunk.
not on the pulmonary, it is on the actually artery, not the trunk. Pulmonary trunk divides into two branches, no? Right pulmonary artery and left pulmonary artery. So if you remember the dorsal, so pulmonary trunk, which is derived from the truncus arteriosus, is continuous with the dorsal part of aortic arch, and sixth arch artery is continuous with the dorsal part of dorsal aspect of the aortic arch, and from that we get the right and left pulmonary arteries. So this is all. And from the actually the ductus arteriosus is connecting the left pulmonary artery to the arch of aorta. Yeah.
So the blood can go into the right.
Yeah, from the yes, it goes to the right pulmonary right lung, but on the left side it goes very less. Yeah. Clear? Okay. So shall we stop now? Maybe you we can discuss this later also. Okay, now actually what happened, because of the last class which was maybe bunked, we have to cut short and we have to go to little fast. But anyhow, okay. So that's all about for today. Okay. Thank you so much. Yeah. ठीक है.